Welcome back to Plastic Surgery Decoded, the podcast designed to help you better understand plastic surgery. We take the mystery out of it in plain language. You'll find it interesting and useful whether you are already planning a procedure or you're just curious. I'm your host, Dr. Regina Nouhan, and we are now into Season 5 of the podcast. After you listen to this episode, know that you can explore and enjoy many other topics, either through your favorite podcast app or through the website at plasticsurgerydecoded.com. The first 40 episodes, or Seasons 1, 2, and 3, comprise the Plastic Surgery Decoded Classics, with my singular voice covering cosmetic and reconstructive procedures, skincare, and general questions about plastic surgery. The remainder of episodes, Seasons 4 and 5, are interviews with my colleagues around the country to help you learn about the subject. A great variety to choose from. Remember that this podcast reflects my experience and opinion, as well as those of any guest interviewed. It is not intended to provide medical advice, nor is it a substitute for a formal consultation with your physician. So come along with me as we explore this ever-growing world of plastic surgery. Let's go! When we think of common aesthetic surgery treatments of various parts of the body, the neck is probably not very high on that list. Yet it's a region that can often leave an impression of advancing age on an observer who might see us in profile or even straight on. An excess fullness of the neck or the loss of that crisp angle might not even be related so much to age as it is to certain genetic tendencies. Either way, there is a good chance that our neck may not accurately reflect how youthful or healthy we truly feel. Enter neck rejuvenation, with the most notable procedure in this category being the neck lift. But what does that involve, and what are the nuances in treatment that can provide best results? We're fortunate to have plastic surgeon Dr. Malcolm Paul with us in conversation today, who has extensive experience with neck rejuvenation. He's seen it all, done it all, and now shares with us his findings and expertise. So let's get right to it. I would like to welcome to our conversation today Dr. Malcolm Paul, who is currently a board-certified plastic surgeon in private practice and also professor of surgery in the Department of Plastic Surgery at the University of Nevada, Las Vegas. Welcome, Dr. Paul.
Thank you.
And it is a treat to have you on the podcast today. You know, some of our listeners will already know your prominent reputation in the plastic surgery world, but others will be just discovering this. And among other accomplishments, you've written a book about our topic today. We're talking about the nuances of the neck lift. And you are the inventor of, among other things, the Princess Facelift, minimizing incisions. So would you please tell us about your current practice? Where is it located, and what type of patients or cases do you focus on mainly?
My practice is located in Las Vegas. I do a lot of facial cosmetic work. The Princess Lift was designed to allow you to elevate the central part of the face through a lower eyelid incision, avoiding any incisions around the ears. Mm-hmm. And it's really valuable almost of any age group, but mainly between, maybe 40 and 55 or 60, when you really don't need a full face and neck lift. The neck lift I got interested in because I always felt that we kind of undertreated the neck.
Yeah.
We'd put a few stitches in and tighten the muscle and take some fat out. So I edited a textbook on how to do this. I brought in some of the best surgeons around the world to write chapters, and I've done probably 500 of these now, some with local anesthesia alone, some with general anesthesia, depending on the patient desires and their general health and what they will tolerate under local anesthesia. And so my practice is really pretty much head and neck work.
Yeah.
And I lecture around that. I just got back from operating two doctors from London, flew to Athens, Greece for me to operate and do their face and neck lift there because I have a former fellow that I train and I can work under his license and operate.
Oh,
and
cool.
He has 5 clinics now in Athens, and I trained him as a fellow about 17 years ago. So I've probably operated in 8 different countries, and I've been doing many, many years of this. I had a clinical professorship at the University of California until I moved to Las Vegas, and so I was former professor there for over 20 years. But my practice really is cosmetic, and also I do some secondary work, patients that may have had some issues with surgery done elsewhere, and eyelid surgery, face and neck work. So I do some revisionary work.
Yes.
But the bulk of my work is probably, facial, brow, eyelids, neck, jawline, lip lifting, facial fat grafting, things of that sort.
Wonderful. Gosh, that's great. I mean, you've such an incredible reputation. Well, we're here to discuss the benefits and the challenges of rejuvenation of the neck. And in my practice, patients would often worry that their neck gives away their age. So let's start with what happens to the neck as we age. Can you kind of take us through that?
Well, there's several things. We learned several years ago that facial aging is more than things just dropping. It's a loss of volume as well as vector or gravity-based changes. The neck is hard to do because everyone looks a little bit different. They may have a variable amount of fat in the neck, muscle bands, prominent submaxillary glands, and fat both in front of the muscles, between and behind the muscles. So most plastic surgeons, I think, really don't do as extensive a work as we try to do in the neck because you have to address all issues from the skin all the way down to the deep layer. So deep plane, so-called deep plane work addresses everything from the skin all the way down to the muscles of the neck, and it takes a while to do it. But the idea is to create a 90-degree angle of the neck, which is youthful. Women look in the mirror and they say, gee, I saw my aunt in the mirror. Or it's Thanksgiving time and they're afraid they're going to go in the oven with the turkey because of the turkey neck. So I really spend a lot of time on neck.
Well, that is great. And we're going to get into surgery in a little bit more detail in a bit here. But given the changes in the neck, what are the main concerns that people come to you for when they request help? What is bothering them? Is it the loss of that angle? Is it just the excess tissue? Or what do you find?
Well, it's usually a combination of gravity-based changes, the neck skin dropping. The muscle bands, these are the platysmal muscle, which runs from the corner of the jaw all the way down to the clavicle. And that muscle begins to pull away almost like a bow and arrow. It separates away from the deep cervical fascia and creates visible bands, which can be from the chin down to the hyoid or all the way down to the clavicles. And based upon what you see, the treatment is different, whether you just need to bring the muscles together, where you need to, what we call a back cut and reset the neck contour. And then the fat has to be removed by liposuction first, and then by looking at the fat between the muscles, which is almost always inadvertently left behind if you don't really have a good look at it. So you got to spend an hour on the neck and really make it look great, because if you don't get the neck right, the rest doesn't really matter, especially if that was their major concern.
Yes, and touching on that a little bit, I'm curious if the patients who come to you are usually worried more about the appearance of their neck before they become focused on the appearance of the face, or do you think it's vice versa?
Because I'm in a warm climate in Nevada, women are wearing, lower clothing and their necks exposed all the time.
Right.
And I tell them, if you don't want a neck lift, you can put on a turtleneck and move to Minneapolis. You'll be fine.
Right. Several
months out of the year, you'd be inside. It'd be perfect.
There you go.
But if you don't want to get put in the oven with a turkey, you need to fix it. And that takes about an hour. But it's usually combined with work along the jawline and upper part of the face, because all things age together. The other thing that's interesting, the woman I saw today lost 40 pounds after the loss of her husband because she stopped eating, and her neck is hanging and the muscles are hanging, and everyone's different. So I find it a challenge. Someone's never the same. Everyone is different. And the only time I'm upset is when I said I don't need to open the neck. I can just tool it from the side, and almost always that doesn't work for especially aging in the 60s and beyond.
Yeah. Well, we've been talking a lot about female necks, but what about men? What percent of neck patients are male, and are their particular cosmetic concerns different from those of females?
Well, it used to be about 85% women and 15% men. But after the COVID, many of the men that thought they could retire had lost money in their IRA and in the value of their home, and they had to keep working.
Sure.
And they felt threatened by the young MBAs that were coming out that wanted their job. So they had to turn the clock back. So, of course, they're minimally invasive. There's botulinum toxin, there's fillers. But you get to a certain point where you sort of fall off the cliff, and those things, if you add them to your jawline, just going to make your face heavy and hang worse. So men have the same problems as women, but they're a little more difficult because they have thick skin and a beard, and you got to respect where the sideburn is and where the posterior hairline is, the back of your neck. Men want to get back to work sooner. They want to go to the gym the next day and play golf, and in general, they're more difficult necks to do because they're usually heavier and more things to do to correct it.
Gotcha. Well, we want to talk about options for neck rejuvenation. Could you walk us through a little bit the minimally invasive to the surgical options? What do you think about minimally invasive treatments?
Well, in a younger patient, we do a limited incision neck lift with the incision under the chin, oftentimes, and around the ear like a U shape. Nothing up in your hair, nothing back in your scalp. and we're able to, I use these dilators I got from a colleague of mine in Brazil, and able to lift all the skin up without detaching it. It works really well. And younger women and men, that works for them. Other older patients that have more going on, more fat, more muscle relaxation, require more aggressive treatment. But everyone's different. It depends on the clinical examination. And, we try to under-promise and over-deliver.
Yes.
Because the neck can age differently. You could be 75 years old, you have a neck lift, and maybe in 6 months you have to have it tightened again because the tissues don't have the tensile strength they did when you were 35 or 40 or 45.
What do you think about some of the less invasive devices like threads or barbed sutures and things like that? Do those have value? Do they have longevity? What are your thoughts?
I did a lot of work with barbed sutures several years ago. In fact, I went to North Carolina. The inventor of that was a wonderful plastic surgeon by the name of Greg Ruff at Duke, and I watched what he was doing. His first barbed sutures, he actually cut them themselves in the back table by making angled cuts in the suture.
You're kidding.
All the way up and down.
He made his own.
Hundreds of cuts to make them barbed.
Oh my gosh.
I use barbed sutures in the face. Sometimes I use them in the central part of the neck. They work well. But standalone, thread lift kind of thing, just a minimal correction for a minimal period of time. They work best in the central part of the face where you've got good structural support to hold the skin up. They don't work on the brow. They don't work well on the neck. Less invasive devices such as radiofrequency, ultrasonic, laser, and so forth have a value, but again, it depends on your age and what you're looking at. They can be additive, Morpheus and Renuvion and things of that sort can be used to get you a little tighter.
Mm-hmm.
But you get to a certain age where you just can't use those devices alone. If you're 35 or 40 or 45, yes. But if you're older than that, they may be used along with what you're doing. There's a lot of work being done on combining Morpheus, or actually neck tight and face tight, bipolar radiofrequency energy to tighten the neck at the same time as an open neck lift and open face lift, and that works very well.
Well, great. Could you just kind of go through the steps of a typical neck lift? You make the incisions, and then what do you do underneath? You're dissecting skin, fat, muscle. With a deeper lift, do you trim some of the muscle? Do you reposition the muscles, whether it's platysmal or digastric?
We start out with an incision horizontally below the chin crease, under the chin.
Mm-hmm.
The reason incision is made behind the crease is because the crease represents a ligament attachment from the bone to the skin. If you make the incision where you think it looks best, as it heals, it kind of pulls in and creates a witch's chin. The chin falls over the incision.
Excellent point.
So we go about a half an inch behind it. You can't see it when everything's pulled up. We start out with liposuction of the neck if you need it. If you're very thin, we don't do it.
Mm-hmm.
Then we use these dilators to release the skin of the central and lateral part of the neck. And then we open the neck with scissors dissection all the way down hyoid, sometimes lower, and see what the muscles look like, see what the fat looks like, take out what's in excess, but not too much, undermine the muscles and tie them together with these barbed sutures.
Mm-hmm.
And then if they're long bands, we go down low and do a very controlled back cut of the muscles so that the muscle pulls back and upwards, which creates a 90-degree angle to the neck. And that's how it's done.
Yes, that's what people want, that nice angle. That's excellent. And what about submandibular glands, which are salivary glands? Do you have to manipulate those? Just for the listeners, sometimes that gland can sag a little bit and create a contour irregularity in the neck, and so that's why sometimes surgeons will address it. Or what do you find?
I've done it. I've done partial resection. It's not a procedure without its own risks.
Yeah.
And as an outpatient procedure, if you get into some bleeding at home, it can be a problem. You can use botulinum toxin, inject it in the gland, and the gland will shrink down, and you don't have to cut out any of it, don't take any of it. And I think that's a much safer approach. And you get some suspension when you tighten the platysmal muscle in the midline, but you can inject directly through the muscle into the gland, or through the skin into the gland, and shrink it down without the risk of taking part of it out and bleeding. And in older patients, you have to be very careful because the salivary gland, obviously produces saliva in your mouth. In older patients, you can wind up with cavities or dental caries from an absence of saliva.
Yeah.
So you have to be very careful to leave enough of the gland behind, especially in older individuals.
Well, very good. I just want to address this because, it's just been in the media so much. I'm sure you've seen that photograph going around of Kris Jenner with her svelte neck and her rejuvenated face. How do you think that type of dramatic result was obtained? I don't know if you're familiar with it or not.
Well, I've seen it, but I think it's more a matter of the dissection that's done and fat grafting and probably external devices using Morpheus 8 or laser resurfacing. Fat grafting makes a big difference in the face, but it's an aggressive deep plane, which means under the fascia, the face and neck, and lifting things up. And I think we obtained similar results to that. But you have to be very careful in social media because that becomes an expectation of the patients.
Truly.
Some things are, photoshopped and things have changed and made to look better than they really are. For example, you can have a neck that looks like it needs a neck lift with your chin bent down and do very little surgery and do the post-op picture with the patient extending their neck. They look great. So you have to match them for lighting and for position to be accurate and to be academically honest.
Exactly right. It could be misleading otherwise. Well, where would you typically perform a neck lift, and what is recovery and downtime like?
We do almost all the procedures in an outpatient surgery center under general anesthesia.
Mm-hmm.
I've done probably more than 300 faces with local anesthesia alone. And for the princess lift, can be done with sedation and oral analgesia and so forth in an office setting. A well-equipped operating room is fine. But most is done. The recovery is about 7 to 10 days, sometimes 2 weeks. But we do a whole bunch of things. For example, over the past few years, we started adding tranexamic acid to our local infiltration. And that was shown in the thoracic surgeons and orthopedic and neurosurgery literature to really stop bruising and bleeding. It's been a tremendous difference.
It's a great drug.
The other thing we do is tumescent anesthesia, where we use under pressure and fill the face and neck up. There's essentially no bleeding. A woman I did, and she was at dinner 2 days later after a face and neck lift.
And just for the listeners, could you explain what tumescence is?
Yeah, tumescent means to expand or to blow up. And so instead of just putting in a small amount of local so that you can dissect the tissues with minimal bleeding, because it has adrenaline that constricts the vessels and stops the bleeding, but you use a larger volume, perhaps 50 or 75 cc's per side of the face, and when you get in to do the dissection, things just sort of peel apart. It's much easier, much less bleeding, less bruising. And I also use tumescent anesthesia in the deeper layer of the face so I can lift up the deep layer without any risk of nerve damage, because it all separates because the water layer divides the two layers.
That's a good technique. Excellent. And what about drains? Are you typically using drains in your patients? And if so, for how long?
Well, it's a good question because we stopped using drains when we started using the hemostatic net.
Tell us about that.
Hemostatic net is a series of sutures developed by, again, a South American plastic surgeon. I use it for brow repositioning and for face and neck, especially in men who are prone to develop, oozing and, swelling and so forth. And what that does, it stays in for a few days. And what you've done is you created a series of tunnels of the face and neck and not a wide open space to accumulate fluid. Therefore, there's no need to put drains in it. Patients love it because it is uncomfortable to have them and to have them removed.
But what it can save you is pretty critical. All right. What about risks that come along with neck lift? What do you tell your patients?
Well, any risk in a facelift is, hematoma or bleeding or nerve damage, nerves that move the face, sensation. There's always numbness of the face and neck because the skin is lifted off of those tissues, and when you lift them off, you have to divide the sensory nerves, but it grows back. I've never had in all these years any sort of permanent nerve injury. You can get some weakness for 7 to 10 days, but I've never had it be permanent in anyone that I've done. There can be problems with wound healing, wound separation behind the ears, but the use of dilators allows you, even in a smoker, who we usually don't operate on, you can actually operate on them safely because you keep all the perforating blood vessels between the deeper layer and the skin so that it's well perfused, and I don't worry about losing any skin.
Yeah, that's excellent. Well, I'm curious, rather than just doing an isolated neck lift, how often are you including treatment of the face in order to get the desired neck results?
Well, almost always. Again, a good question. If you do the neck only, you can do that in a younger person. But as you begin to get the jowling, and what happens is that the cheek sort of flows into the neck, and you lose that distinct border along the mandible. Mm-hmm. So to answer your question, frequently you at least have to do the lower part of the face with it, because otherwise you have a nice-looking neck and you still have jowling and relaxation along the jawline, and so it really should be done together to get the best result.
And then combining therapies, you alluded earlier to things like Rejuvenation to try to treat skin. How often are you doing that with the neck lift rather than instead of the neck lift?
I usually don't do it. I don't do it, but it's available. I just am happy with what I've got. I do send patients for aftercare with an esthetician to maintain the result that we've got.
Good.
And that's skin care. That may be some device work, maybe Morpheus to tighten the skin further. But and you can do laser resurfacing in safe areas that have not been lifted at the same time as the face and neck lift. This sort of central area of the face, called an eye area, the letter I across the forehead down around the mouth.
Hmm.
But areas that have been lifted should not be treated with laser for the risk of losing the blood supply and having scarring.
Right, because you're kind of hurting the tissue on top and down below, so you can really cause problems. Absolutely.
Right, right.
And I'm curious your thoughts. You've done so many of these now. What do you find the most challenging aspect of neck rejuvenation?
Well, no matter how well you do this, you're going to have some patients that are going to get recurrent bands in their neck,
Yes.
a recurrent relaxation. I always say, you'll never need as big an operation as we do the first time, but you may have to in 6 or 12 months tighten a little bit more. Or if you're really lucky, you'll go 5 or 10 years before you have to do anything, and that's what the goal is.
That's a great way to approach it, I think. Well, gosh, we're almost finished here, but I'm wondering if you have a story about a particular patient you'd like to share, maybe how treatment with the neck lift really had a positive impact on their life.
Well, I think when women say that, they looked in the mirror and saw their aunt, and that's why they decided to get their neck fixed, because they saw their aunt in the mirror rather than themselves, because of the laxity of the neck and the turkey gobbler sort of thing. It's kind of hard to pin down on one patient, but I do remember doing a woman who she was about to get married for the second time, and doing her neck was really important to her, and especially if there's a disparity in ages,
Oh,
you want to
yes.
look better, and 10 or 15 years of rolling the clock back is helpful. But I have so many over several decades of doing this, I don't have to think about it, but there are those that come in and say, I finally look as good on the outside as I feel on the inside, and that's the reward they get.
Man, that's got to feel great. That's what we're after, isn't it? Well, Dr. Malcolm Paul, you've just been wonderful sharing your time with us today and your expertise. Thank you so much. I'm curious if you have any lasting thoughts you'd like to leave the listeners with, whether it's about neck rejuvenation or just about plastic surgery in general. What would you say?
Well, I think, just be careful about what you see in social media and realize that, we're going to put our best results out there. We had an interesting study done where women that are in the age group that do the most common cosmetic procedures, which are really, breast surgery and liposuction, are more likely to pick their plastic surgeon based upon social media than based upon training and experience.
Yeah, sadly.
So sort of buyer beware. I tell patients, don't try and save money on your plastic surgeon or your parachute, those two things.
That's good advice. Well, that's where we'll leave it. Thank you, Dr. Malcolm Paul. Really appreciate your time. Take care.
My pleasure. Nice speaking with you. Bye-bye.
Well, that's our show for today. Hope you enjoyed it and learned something too. Don't forget to subscribe, rate, and review. Please share this podcast with someone else who might be interested. And while you're at it, check out the podcast website for related topics to explore. It's www.plasticsurgerydecoded.com. And as always, thank you for listening to Plastic Surgery Decoded.